everybody. I am Dr. David Geier, orthopedic surgeon and sports medicine expert. Welcoming you to Ask Dr. Geier Live. Yes, I am about 10 minutes early. I announced through my email list, and if you want to be notified when I'm going to be on live on YouTube, you want to be notified ahead of time when I'm going to be on live. I send those announcements out about a week in advance on my email list. There's a link below in the description that tells you how you can sign up for that email list, and then you'll be notified when I'm on live. But I said 7 o'clock Eastern time, and I am early, and that's because I have a hard stop at 7:30 Eastern time, and maybe even a few minutes earlier than that. I've got somewhere I needed to be, so I am not going to be able to run super long, so I just decided I will go ahead and get started. I will stick around for the people that get here at 7, so that's okay. A few things that I want to mention as people start to come in here. I do these once a month, so definitely look out for these. I will answer any questions, but there's a few caveats. So if you want to talk about some of the challenges that I've been doing in recent videos, like the Verson climber and the sensory deprivation tank and the cryotherapy and the whole body stretching and the infrared sauna, definitely ask about that. If you have a sports or exercise injury, definitely shoot those my way. Couple things about that I will say about sports and exercise injuries, though, that a couple things if you want to make it more likely that I answer questions. And I get this in the comments to all my videos. Every now and then somebody will be like, well, why don't you answer so many of these comments? I can't give specific medical advice. Everything I'm going to answer in the comments on those videos, in my videos themselves, and on these chats is meant for general information and educational purposes only, because I'm not your doctor. I haven't seen you, I haven't examined you, so definitely ask it in a way that just understand I'm not giving specific medical advice. So 2 kind of pieces of advice so that it helps me answer. 1, kind of keep the question short. No more than 2 or 3 lines, because it's hard for me to see that in the chat, and quite honestly, people don't want to hear a real long description. The second thing I'd say is ask it in a general way. So rather than asking, what graft should I use for my ACL surgery, say, hey, what are your thoughts on allografts or autografts or patella tendon grafts or hamstring grafts for ACL surgery, not what should I do. So those are the couple sort of key points that I would say as far as all of that goes. So remember, you can ask anything. I've got some questions. I know I'm early, and these are questions that I saw in the comments to some of my videos the last couple days. I will certainly answer those. Leave those in the chat if I miss them, and I will, post it again. I'll try to get to everybody, but once there's a lot of people here, sometimes I do miss comments. So I will do my best to answer all of your questions. All right, first one I'm going to answer. Travis has a question about a mallet finger injury. Travis says, what if it's only been a week and a half? Because when it first happened, I was stuck in the country, but I just made it in town last week. Would I still be able to have something done because it really hurts? All right, I got all these anatomical models so I can kind of show what these injuries are. So a mallet finger is when, I don't know if you can see my hand model there. Typically it's in sports where like a ball hits you on the tip of the finger and it sort of bends that finger down. And the tendon that extends that finger, that straightens it out, sort of gets pulled off the bone. And what can happen is that then basically you've got like your 4th finger or your 3rd finger where the tip of your finger is bending down, and because that extensor tendon is ruptured off the bone, you can't straighten it all the way out. Now that will almost always heal if you get to it really quickly, and treat it and immobilize it with one of those splints that keep the tip of your finger straight. But you've got to do it pretty much all the time for about 6 weeks. Now, yeah, you can start that a week or 2 weeks after the injury, but you're essentially starting, that's now your point 0, and you're now going to be in that splint for 6 or 8 weeks, whatever it takes. And if you take it off and it droops again, then you're starting all back over. The further, though, out you get from the injury, the less likely that works. So the sooner you can kind of get to that treatment, the better. All right, let me go back through chat here. David, good to have you here, David. I don't know how you say your name. Weissman, it's kind of small on my screen. I apologize, David. It's going away. Hang on, David. Sorry. 15 days after ACL surgery, still struggling to straighten my leg. Any advice on fast rehab process? Okay, and then the burning sensation around the knee. I wouldn't think so, but it's hard. There's a lot of factors. That one, I'd probably talk to your doctor about. All right, advice, early phases of rehab. He kind of hit at the very first one. I think that is a big deal for ACL surgery, and that is getting your knee straight right away. I just did an ACL today actually, and I told the patient this before we start. Your number one goal after your ACL surgery, as a patient, your number one goal is to get your knee straight as soon as possible. I have my patients pretty much always stay with their knee straight if they're laying on the couch, if they're in bed, whatever. The mistake a lot of people make is they put pillows or something under their knee, which kind of keeps their knee bent a little bit. Where's my knee model? Keeps their knee bent just a little bit, and that is not what you want. You want to keep it perfectly straight. And so put the pillows under your foot, put them on, something where the gravity keeps your knee all the way straight. But you got to really get that quickly. I tell patients that they've got about 4 weeks to get their knee straight. After that, it's really, really hard to get it after that. Physical therapy doesn't have much success if you don't have full extension by 4 weeks. There are devices that might help a few degrees. And the problem is, if it's only like 5 degrees or so that you're lacking, that's really hard for me to get back as a surgeon, to go back in and scope the knee and clean out scar tissue. Maybe you get a few extra degrees, but this is getting full extension, getting all your motion back is much more about prevention than treatment. You want to take care of it on the front end and make sure your knee doesn't get stiff rather than dealing with it if it does, because that's a hard problem. If you don't have full knee extension, it's hard to walk normally, it's hard to run normally, it's just hard to really do the things the way you want to do it. The other thing I really push early on is quad strength. And the first few days, that may be straight leg raises. That may be all kinds of repetition, things like that. So, straight leg raise against gravity. Then once you can do it once, get to where you can do it 10 times. Then get to where you can do it 100 times. The physical therapist will show you different ways to get your strength back, get the swelling down, get your motion back. But those are my first two goals. For patients right away. Get their quad strength coming as fast as they can, get full knee extension, and work with a physical therapist. ACL surgery is not something you can overcome just doing exercises on your own. In my experience, because I've had a few stubborn patients, not because I said it was okay, that does not typically go very well at all. So good luck with that, David. All right, Jada, what's the recovery like post-MPFL reconstruction surgery? It's funny, I just scheduled somebody out of my clinic for MPFL surgery today, or talked about it. We didn't actually schedule it. So what that is, let me get my handy dandy knee model again, see how well you can see that. The MPFL, so if this is the medial side of the knee, that's the lateral side. So side closest to the midline, side away from the midline, kneecaps right here. The MPFL is this tissue, let me get my finger out of the way here, the tissue that holds the kneecap in place and keeps it from dislocating like that. And if somebody has either a traumatic patellar dislocation one time or it becomes a recurrent problem, sometimes we'll go in and basically rebuild or reconstruct or make a new medial patellofemoral ligament, MPFL. It's very similar to an ACL, maybe a little bit quicker actually, but you still have to protect that. Now it's a little different from an ACL in terms of what stress you can allow. Typically, I will put somebody in a knee brace to prevent side-to-side stress, but I do work to get their knee motion back pretty quickly. But early, it's getting full extension, it's getting quad strength, limiting a lot of stress on the MPFL, and then you work through the process of getting motion back, getting strength back, going to jogging and sport-specific drills. Overall, in my experience, it's about a 4-month recovery. If you're a high-level athlete like college or pros, probably more like 6 months. All right, Godfrey. Hi, Doc. Hey, Godfrey, thanks for joining us, by the way. I had replacement femur surgery. I'm not, let's see, I'm not 100% sure what that is. Intramedullary nail. So I got you. He had a femur fracture broken in 2 places and was it was done with a nail, and it said, is that good? Without seeing it, I don't know. Typically, so the femur, I don't have a model of this, but that's your thigh bone. If you break it in the mid shaft of the bone, or even lower but still above the knee, or higher but still below the hip, my experience, the best way to fix that is with a metal rod, an intramedullary nail, is what some people call it, because it's a load-bearing device. You can walk on it right away, and the weight bearing helps compression, so that can be really, really helpful. It's still a tough surgery. I'm not going to lie about that. You're probably looking at 4 months or more for that to fully heal and get all your strength back, walking normally, things like that. But you can have good outcomes from that for sure. All right, Kate, I'm a basketball player and had a stress fracture of the metatarsal. The swelling's not painful and doesn't subside. It's really frustrating. Yeah, stress fractures are tricky for athletes. I think you have to really shut people down. And if you're not familiar with the metatarsals, let me show you my handy dandy foot model. You're welcome, Godfrey. I hope that was helpful. The metatarsals are these long bones of the foot under the toes. So you got the toe bones, the bones in the toe there, the phalanges. The metatarsals are the long bones. And in runners and jumping athletes, stress fractures are difficult because they typically are overuse. Somebody that has been on their feet and been running, ramped up their training, ramped up their jogging, and now all of a sudden they start getting pain and they try to play through it. And it's just not getting better. The more they train, the more likely that is to become a stress fracture. And the problem is to get that to heal. Hey, Richard, you've got to really shut them down, and that's really hard. So without knowing Kate's situation, my guess is that you're going to have to shut her down from basketball for a while. All right, let me go. David, you're welcome. Wow, I'm impressed that I got David's last name pronounced right. I appreciate that. Let's see. And then full bending, David, you've got a little more time with that. Patients typically you've got about 6 weeks to get full flexion back. How much you can advance the bending right away, though, depends on other factors like a meniscus tear at the same time. So that's when you really want to ask your surgeon. But you can generally take up to about 6 weeks to get flexion back. You got to get knee extension back really quickly. All right, Lisa, what could be causing my elbow to crack when I put my arm straight? And when it does that, my hand and fingers go numb right away. I don't know. So before I get into Lisa's question, and Lisa, thank you for the question, couple things, and this may or may not apply to her. And I will tell you, if you go to an orthopedic surgeon and ask about why my knee or why my shoulder or whatever pops, you're going to get an answer sort of like this. We're not really concerned with popping. There's a lot of normal reasons for popping that are not caused by structural damage, not caused by a piece of cartilage loose or a torn meniscus in the knee or a ligament damage or anything like that. In the knee, if you go find a high school female soccer team or a high school female basketball team and sort of put all their knees through a range of motion, you're going to feel sort of a popping, grinding sensation in a quarter of them or a third of them, and they have no damage in their knees. So we don't get terribly worked up about it. What we get worked up about is if you're having a lot of pain with popping or, there's something damaged. As orthopedic surgeons, we fix structural damage. If it's not something torn, something broken, something like that, it's a lot trickier. As far as the elbow, the thing that your doctor is going to want to try to figure out is that popping inside the elbow or is it something around the elbow? The whole numbness, tingling, I can't come up with any good reasons for that other than, and again, I don't know if this is what's going on, so definitely, Lisa, go get this checked out. But there is a nerve on the inside of your elbow, the ulnar nerve. When you hear funny bone, when somebody hits that bone right there, why it causes numbness and tingling and a shooting sensation down your arm is you're actually hitting the nerve on the inside of your elbow, your ulnar nerve. There are some people that ulnar nerve can snap back and forth and be pretty uncomfortable. You don't typically hear it, but then that can cause numbness and tingling sort of down the inside of the forearm, ring finger and little finger. I don't know. Short of that, I don't know, because the other things inside, like a plica inside the elbow or even loose piece of cartilage, wouldn't have any neurologic symptoms. So I don't have a great explanation for that. As I've said to everybody, though, Lisa, probably go get that checked out. That is probably kind of the best thing to do. David, thank you. Sounds like me taking on the cross trainer at day 5 was a good idea. Hope you agree. Yeah, that's one I would ask your doctor. Again, there's so many variables about what, if there was cartilage damage, if there was a meniscus tear. I do typically get people moving pretty quickly. Stationary bike almost immediately, usually elliptical by about 2 weeks, things like that. There's not a one-size-fits-all with ACL reconstruction, but I am very aggressive. This is not a surgery that you lay on the couch and do nothing for 6 weeks. You get people moving right away. All right, what other questions do you have? I've got 1 or 2 others that people have sent today ahead of time that I'll try to answer. If you want to ask about Liverpool, yes, I'm not in scrubs like I normally am, because, like I said, I've got somewhere I need to go. I was in scrubs all day between surgery and clinic, but I decided I needed a shower because I was disgusting. So sorry for not looking as professional as normal. Sachin asked me a little while ago, and I'm going to try to get the tone of his question right. I have a partial ACL tear, chronic, and have a meniscus injury. I'm an active 23-year-old person and I want to join the defense forces. Good for you. I feel pain after some walking and I'm not able to run. Do I need to have surgery? Okay, this is a tricky one. And again, as I've said all along, I'm not going to tell him necessarily should he have surgery. He needs to talk to his surgeon and make that decision for himself. Here's the thing. Whether or not you deal with the ACL injury, and not all partial ACL tears need injury, but I'll tell you, there aren't that many partial ACL tears. Most of the time, what you'll see on these MRI reports is what you call a high-grade partial tear, meaning when you get the MRI, there's a few fibers still hanging on, but the rest of it is torn, and the few fibers hanging on are all stretched out. So it's essentially a complete ACL tear. The knee's still unstable. The number of partial ACL tears that only a little bit of it's torn, it's not that high. But for active people, even if ignoring the ACL for a second, the pain from the meniscus tear can be problematic for a lot of people. And especially the military, which is so active, that tends to catch up to people and limit their ability to do what they want to do. On the ACL side, if your knee's giving out and that's causing problems, it's going to be really hard to be active because your knee buckles as you go to run, as you go to change directions, things like that. And so it can get really, really tricky. My patients are active. I do sports medicine, so they're anywhere from maybe 8 to 10 to about 50, 55 years old. They want to play sports. They want to exercise. They may try rehab and giving it a little time. Most of the time, they end up saying, hey, look, I need to ultimately have surgery. Actually, the ACL I did today in surgery, she was in her 50s, early 50s, but super active. And so there was no chance of me talking her out of surgery. So I think for a lot of people, especially if you're really active, it can be the right thing to do. All right, any other questions? I'm going to stay on just a little bit longer if nobody has any questions. What else? Saw some really good injuries in clinic today. I can't, for confidentiality reasons, say, but boy, I tell you, people had some really weird ways of getting hurt. I'm always kind of impressed by that. So if you have a really interesting way that you got hurt, some story that nobody would believe, I would love to hear it. Richard, hey Richard, thanks for joining us. How long will I have to wait to play soccer again after this Jones fracture surgery? It's been 2 months since my surgery already. All right, so that's a great question. I answered a version of this. I did a radio interview before starting this, and they were asking me, the radio host was asking me about the Baltimore Ravens tight end Hayden Hurst, who played not too far from where I am at the University of South Carolina. And he has, they just say a stress fracture of his foot. They didn't say what bone. But I have no doubt that it was a Jones fracture, a fifth metatarsal fracture. And they were saying 3 to 4 weeks he'd be back. And I told them I find that really, really hard to believe. So typically surgery involves putting a screw, where'd my foot model go? Putting a screw, if you guys can see my model of the foot, this is this side. the outside of the foot. That's the fifth toe. So this is the fifth metatarsal, and you put a screw, let me put it this way so you can see it, right down the center of the bone. And typically that surgery goes really well. It's an outpatient surgery. It takes about maybe 20 to 30 minutes. Recovery is pretty long though, because you've got to get that bone to heal. In my experience, the quickest is about 6 to 8 weeks that it heals. Then you start running and doing sport-specific drills. I've actually done this on pro soccer players, so I mean, I know kind of the timeline. And generally, and I can't remember the last pro soccer player I did. Sorry, hold on. But I think he was jogging by 8 weeks, and I think he was playing by about 10. But the thing is, if you rush it and it hasn't completely healed, the risk you run is that it doesn't go on to heal, and you end up needing a second surgery where you take that first screw out and you put a bigger one in, or even do bone grafting and stuff. You don't want to go through that. That's a mess, and it takes a whole long time to recover from. So you take as long as you need to get the x-ray to heal. The amount of time is not magic. It's not 4 weeks or 6 weeks or 8 weeks and that's it. It's based on, you get x-rays over a period of time, and when you see that bone is healed, and based on if the patient's having symptoms, and then you gradually let them return to activity. So for some people it may be 6 weeks. For some people it may be 12. That's typically how it goes. All right, let's see what we got. Headaches, always headaches because of nasal congestion. That's just, it's a little outside of what I do. I apologize. It's just not really headaches or ENT type stuff. I'd love to give you advice. That's just not what I do. Ricardo, I have a full ACL rupture, lateral meniscus tear. It took me 12 weeks to be able to walk again due to slow physiotherapy. How much range of motion does my knee need before surgery? That is a really, really good question. So we were talking a little earlier with one of the questions about getting knee range of motion and getting knee extension and knee flexion back as quickly as possible after surgery. And the reason for that is that one of the biggest risks of ACL surgeries, one of the biggest complications of ACL surgeries is a stiff knee, that you don't get all your motion back. And you want to prevent that, not treat it. And so one of the thoughts that lowers your risk of having a stiff knee after surgery is not going into surgery with a stiff knee. So ideally, and there's probably some debate about this among orthopedic surgeons, but generally we like to go into surgery with full extension, and we like to have flexion to about 110 degrees. Now that's not the only factor. You also want to get rid of all the swelling before ACL surgery. That's why the pro athletes, when you hear they tore their ACL, that's why they don't have surgery the next day. Sometimes it's 2 or 3 weeks later. They're getting the swelling down. They're getting the full knee straight, the knee extension, and they're getting the bending. Some people say 0 to 90. I like 0 to 110 if possible. I really don't. In fact, I almost never do the surgery if people are like barely able to bend it to 45 or 70 degrees. Unless there's some extenuating circumstance, I generally think that is a tough thing. Jesus, thanks for joining us, Jesus. I had ACL surgery 9 months ago, but I haven't done any, it's going away, had any physical therapy. I don't know what to do. Yeah, I don't know what to tell you. I think that, Jesus, I don't know if you were here earlier in the chat. I said that is not a surgery that goes well without physical therapy. I will say that even if somebody hasn't done it, that doesn't mean that they won't benefit from physical therapy now. It just may be a lot harder and a lot longer, and maybe ultimately not quite as successful as doing it sooner. But that doesn't mean it's possible. What other questions do you have? I got probably 5 to 10 more minutes, possibly, if you guys have questions. Yeah, shoot them my way. I don't have too much else to tell you. I still want to hear interesting injury stories if some of you have cool ways that you got hurt. I'd love to share some of what I heard today in clinic. You love some of those days where people just have really funny stories, even though now that they're hurt, they probably don't think they're funny. But when they look back at them, they probably will. All right, well, maybe I've answered all that I saw. I really enjoyed it. I appreciate you joining. And if you're watching this later because you missed the live stream, definitely there's a link in the description below that you can sign up for my email list. And I usually send out 2 reminders ahead of time to talk about, hey, I'm going to be online doing Ask Dr. Geier Live. So just sign up for that list. The link is down below. Also, just subscribe to my YouTube channel, and if you have the notification tabs on, you will get notified when I'm on live. I am debating, rather than doing just this monthly, there's a chance starting in the next few months, I might actually do the podcast that I do, the Dr. David Geier Show. One of those segments in that show is Ask Dr. Geier Questions. I might start to do that whole show live and let people, where I do the podcast recording as normal, but I do a live YouTube stream so that it's interactive. Still debating that. All right, I'm going to answer one more question and then I got to go. So whoever just did the last one is what I'm going to do. Ricardo, is it possible for me to get rid of walking with a limp before surgery? I certainly would try. I mean, get in with a physical therapist and work like crazy. The question, and this is why I can't give you advice, because I haven't, without knowing the MRI, is there a meniscus tear or some other reason that's blocking motion? It's hard to know. But yeah, you would like to be able to walk without a limp before going into ACL surgery. So everybody, thank you so much for those questions. I hope my information was helpful. Really, really enjoyed being here. I love helping you with whatever your exercise or sports injury is, because I want you to be as strong as possible. Come back stronger than ever. Thank you guys so much.